Hello everyone, this is Dr. Kim, and in today's video I would like to show you a CBCT scan of a patient who is 80 years of age. Just from our background or medical information that we know, as we age, we tend to lose the overall bone density and often are diagnosed with osteopenia or osteoporosis. In this particular patient, what I have noticed is that there is a significant loss of trabecular bone density in the posterior mandibular region, and I would like to show that um, over the next minute or two. Why don't we look at this axial view? This is an edentulous patient, or the patient with edentulous mandibular arch with 4 dental implants which have been all osseointegrated. But as you look at the posterior region of the mandible, we can see that there is not a lot of bone pattern that we see in the anterior part. And having seen many cone beam CT scans in the past, even the thickness of the cortical plates that we see, or that I see, is certainly narrower in this patient than someone, say, in their 20s or 30s. So let me scroll up and down, and I want you to see that there are large marrow spaces present throughout the scan, and it's particularly more severe in the posterior mandible. Likewise, as we look through the coronal view, again the bone density isn't as high as someone who's younger, but we can see a little more trabecular pattern. And let's go distally, and I want you to see that there's large areas of radiolucencies in posterior mandible. As I turn the volume in order to look at a corrected sagittal view, here from this corrected sagittal view you can appreciate the amount of bone loss this patient sustained over the course of her life. And I do not know whether this patient is on anti-resorptive medication, but based on its appearance, I am quite certain that this patient has osteoporosis, or at least osteopenia, and we would expect that in someone in this age group as well. So one of the difficulty with patient that has been diagnosed with severe osteoporosis is that we no longer confidently trace the mandibular canal, which can pose a challenge when you're treatment planning for an implant. So you'll have to guess the height of the ridge and stay on the conservative side. Let's take a look at the other side, and this is patient's left side of the mandible. Looks like the severity perhaps isn't as worse as the patient's right side, but again we can see large sparse area with incomplete cortication, or lack of, should I say, cortication of the mandibular canal. It's better visualized. The mantle foramen is well visualized, and along with the distally extending cortication, but once we're in this area, it is not very well visualized. We can still see, I think, some trace of cortication. Okay, that's all I wanted to mention, and thank you very much for your attention, and I will see you in the next video. Take care.